I tried to ignore the problem of incivility in nursing because I was embarrassed a bit and ashamed that this behavior could be present in our benevolent, caring profession. We've consistently ranked #1 in Gallup's annual poll of honesty and ethical standards in professions for the past 15 years. How can we then be perpetrators of lateral violence? When a major nursing journal asked me to write an article on it with a specific title, I refused, saying I never wanted that phrase about nurses consuming their offspring to ever be uttered again. Yet the problem cannot be ignored and must be addressed. I was shocked and mortified to learn that 45% of nurses have been verbally harassed or bullied by other nurses. 41% say they've been bullied by managers or administrators. 38% reported being verbally harassed by physicians. More than half of nurses who reported work harassment indicated they were considering leaving the profession altogether. Bullying and disruptive behaviors capture the attention of our patients, providers, and visitors, which can extend to the community. Worse yet, it can impact patient outcomes. According to an article published in Fierce Healthcare in 2013, a study in the UK reported that 1 in 4 doctors and surgeons and 1 in 3 nurses said bullying has caused them to behave in ways that are bad for patient care. 71% of doctors and nurses linked incivility to medical errors, and 21% tied it to a patient's death. So what exactly is going on, and how do we stop it? In the timeless Disney movie Bambi, Thumper gives great advice. If you can't say something nice, don't say anything at all. Wouldn't the world and our work environments be better places if we all heeded the wisdom of that wise little rabbit? Workplace Bullying Institute says that bullying is repeated, harmful mistreatment by 1 or more perpetrators who target their victims with conduct that is threatening, humiliating, abusive, isolating, and/or sabotaging. While some forms of bullying are overt, there are others more subtle, such as teasing or saying something mean and then pretending it's a joke, or turning 1 or more persons against one another, shifting loyalties, being friends one day and enemies the next, betraying confidences, intentionally excluding someone from an event or conversation, manipulating someone to do things that are misleading, rolling your eyes, sighing, fake smiles, mean gestures, using non-verbal intimidation tactics such as glaring or the silent treatment. Sounds a bit like our junior high days, doesn't it? Unfortunately, bullying can also be more overt. For example, falsely accusing someone of making errors, criticizing in front of staff or patients, refusing to acknowledge quality work, starting or spreading malicious rumors or gossip, shouting or public humiliation, stealing credit for work, making unreasonable demands, sabotaging a person's work, refusing to help them, discounting the person's feelings or perspectives, or shaming over the lack of knowledge. So if this ever happens to you, what do you do? Well, when targeted by a bully, it's best to just keep your cool and face this nonsense with grace and dignity. Try ignoring it at first, the time or two, and say nothing and smile. That annoys the heck out of them. Sometimes when they see that they can intimidate you, they stop. Or try using humor to deflect it. Ask them if they're having a bad day or if something's troubling them. If you feel your own aggression escalating, stay calm. Don't fuel the situation. Take a few minutes to breathe and regroup. Avoid rehashing it with coworkers. That can cause unit-wide drama and coworkers taking sides. If these simple strategies are not effective, It's time to take the next steps. You need to call it what it is. Acknowledge that you're being psychologically harassed and speak up. Politely and quietly, call out the incident when it happens. State the problem and the possible consequences if it doesn't change. For example, if you continue to behave this way toward me or speak to me in this manner, I'll have to speak with our manager and make a formal complaint. If the behavior continues, follow through. I taught my kids the difference between being a Ralph Reporter and a Tommy Tattletale. For the sake of a healthy work environment for all, you have the responsibility to report this conduct. Without action, it's unlikely the bully will change, and certainly not as quickly as needed. And be sure to document it. Bullies rarely treat someone badly in front of a supervisor. Without obsessing about it, document each incident. Record the date and time of each event and eyewitnesses if there are any. If bullying is digital or written, make copies. Now, before making a digital recording of the abuse, make sure you reside in a single consent recording state, meaning it's legal for you to record verbal exchanges without his or her knowledge. And then report it. Once you document the bully's behavior, take it to your immediate supervisor. Or if your supervisor is the bully, report them to their manager. When making your case, frame the issue on how it impacts care and productivity. Even though your emotional toll is legitimate, it's best to emphasize how the bullying affects team morale, work performance, and patient care. Unfortunately, you might expect possible retaliation. It's likely the bully will hear about your report, and don't be surprised if they get back at you in a subtle way, even if they promised your manager they would make amends. If that happens, record these incidents too. And remember to practice self-care. Being the target of bullying is extremely stressful. Make your health a priority. Be vigilant about good nutrition and sleep and exercise. Practice the stress reduction tips and my self-care strategies in my Self-Care for Healthcare program. Remember to use your skills of deep breathing, positive thinking, laughter. Forgiveness will be a crucial tool, as well as connecting with your higher power. If you're not a victim of lateral violence, but you witness it, you can have an impact on improving your work environment. Derail the gossip by switching subjects or injecting positive comments about the coworker, especially the one being harassed. Share positive gossip and good things you've heard, especially about the victim. When you hear suspicious statements, ask, do you know for sure if that's true? And before you repeat gossip, ask yourself, is this helpful? Would I say it if the person was sitting next to me? What's my motivation in repeating it? If this behavior is affecting your work environment, privately discuss your observations with your manager. Wise people have known for years that the secret for harmony in the workplace and every place is the golden rule. Do unto others as you would have them do unto you. That's the Christian version. But did you know that the rule is in most faiths? Hurt not others in ways that you yourself would find hurtful is Buddhism. In Judaism, what is hateful to you, do not do to your fellow man. And in Islam, no one of you is a believer until he desires for his brother that which he desires for himself. In the Baha'i faith, blessed is he who preferred his brother before himself. Though simple, this message is radical and contrary to human nature. Human nature is to treat others the way they treat you, but doing so puts them in control. Their behavior determines your behavior. The golden rule puts you in control. Let's control our own behaviors, communications, and workplace environments. Nurses and all healthcare workers endure difficult working conditions, often going a long time without food and drink or even bathroom breaks in spite of my nagging. Perhaps worse, they generally cannot step away for a breather when emotions run high or the atmosphere on the unit is tense. They must stay and keep working to focus on patients who depend on them. But this is no excuse for unkind, disrespectful behavior. We are all responsible for creating positive, healthy, joyful work environments. Nurses must be able to work as a team and to depend on each other. We're empowered to keep patients safe, provide high-quality care, and deliver positive patient experiences. If bullying or incivility is a common occurrence in your workplace, these outcomes will be compromised. And we took pledges to heal our patients, ourselves, and each other. Maybe Thumper was right. We should either, if we can't say something nice, just not say anything at all. Let's end incivility. Let's care for ourselves and each other.